Hi, good afternoon everyone. Today I will be talking about cirrhosis of liver. Cirrhosis of liver is an irreversible liver condition. When the fibrosis progresses from stage 1 to stage 4, that is stage 4 is cirrhosis. Stage 1, 2 and 3 is reversible. Stage 4 is cirrhosis which is irreversible. So what are the causes of cirrhosis? The most common cause of cirrhosis currently it is alcoholic liver disease. Second comes fatty liver disease, which if there is a fatty liver which has been left for a longer duration, say about 10 to 20 years, it progresses to the development of cirrhosis. Other causes: hepatitis B, hepatitis C, and rare causes such as autoimmune disease, Wilson's disease, and other metabolic disorders. They also can cause hardening of liver if they persist for a longer duration. So what are the signs and symptoms of cirrhosis of liver? Most of the time cirrhosis of liver is routinely detected on a health checkup where the ultrasound is done. They'll find that the liver is nodular or the liver is shrunken. That means you have a cirrhosis. So in rest about 20 to 40% of the time cirrhosis presents as a symptoms. Mainly a patient coming to you with to the OPD or to the emergency with the symptom of jaundice, building up of fluid in the tummy, or swelling of both the legs, vomiting of blood or passage of blood in stools, or altered consciousness levels or a memory disturbance with increased daytime sleepiness. These are the symptoms of cirrhosis, which is seen about 30 to 40% of the times. So how are you going to treat cirrhosis? The cirrhosis passes through the 3 stages. We use a score as MELD score, and the staging or a grading of cirrhosis is done by something called Child-Turcotte score, that is A, B and C. We never quantify cirrhosis in the terms of percentage. So we can't say that your liver is 10% functional and 90% is gone. But for a cirrhosis, it is a grading which is necessary. So grade A cirrhosis means definitely you have a cirrhosis, but it is compensated. Means you don't have any complications of cirrhosis either in the form of jaundice and other symptoms which I have already elaborated. Grade B means you have cirrhosis and you are not sick, and definitely you require a workup for transplant. Grade C of CTP score means you are already very sick and you need to be listed for transplant as on an emergency basis. So it will be so advanced so that in a grade C, most of the patients they die without transplant. So it is necessary that in the early stages of cirrhosis such as CTP score grade A, grade B and early C, one has to work up for transplant and should be counseled for liver transplant as well.